Ever wondered how obsessive compulsive disorder, or OCD, differs from obsessive compulsive personality disorder, or OCPD? Well, we're about to dive into these intriguing psychological phenomena. First, let's give each of them a definition. OCD is a mental disorder characterized by recurring, anxiety-provoking thoughts or obsessions along with compulsive behaviors aimed at reducing this anxiety. On the other hand, OCPD is a personality style marked by excessive perfectionism, attention to detail, and organization, often at the expense of flexibility and spontaneity. Now, how do these disorders manifest? In OCD, obsessions can include disturbing, recurring thoughts or mental images. They're unwanted and often not grounded in reality. They may include fears of contamination, excessive doubt, or an obsession with order and arrangement. Compulsive behaviors, on the other hand, are repetitive actions performed in response to these obsessions. These can include excessive hand-washing, repeatedly checking locked doors, obsessively counting, or meticulously organizing objects. In contrast, OCPD traits include perfectionism to the point where it can hinder completion, excessive adherence to rules and procedures, hesitation in decision-making due to fear of error, oversaving to the point of stinginess, and dedication to work at the expense of personal relationships or leisure. What causes these disorders? For OCD, biological factors like an imbalance in neurotransmitters like serotonin, genetic factors such as a family history of the disorder, and environmental factors like exposure to psychological trauma or repeated stress are considered. For OCPD, biological factors could be related to overactivity in certain areas of the brain, upbringing factors like strict parenting or excessive attention to detail in childhood, and psychological factors like a need for control. Both these disorders can significantly disrupt daily life, social relationships, and productivity at work or school. They can also cause a feeling of exhaustion due to the compulsive actions in OCD or the excessive mental strain in OCPD. So, how are these disorders treated? For OCD, psychological treatments like cognitive behavioral therapy, or CBT, which aims to identify and change unhealthy thought patterns, and exposure and response prevention, or ERP, which gradually exposes a person to obsessions while preventing compulsive actions, are commonly used. Medication like antidepressants and anti-anxiety drugs are also part of the treatment plan. In severe cases, physical treatments like deep brain stimulation or electroconvulsive therapy can be used. For OCPD, psychological treatments focus on developing flexible thinking and improving interpersonal skills. In some cases, antidepressants may be used to improve symptoms. To summarize, OCD is a psychological disorder involving obsessions and compulsions that affect an individual, whereas OCPD is a pervasive personality style characterized by excessive perfectionism and over-organization. They differ in degree and kind, and early treatment for both can help minimize their negative impact on an individual's life.